Hello everyone, we're from small group discussion B9 and we're presenting our Zoom project on health system based practice entitled Anemia in Pregnant Women. Here are our group members. My name is Karen Angela and my student ID number is 025 So anemia is a preventable condition that significantly impacts pregnant women now requiring urgent attention. The WHO defines anemia as hemoglobin levels below 11 grams per deciliter, but diagnosing it during pregnancy can be challenging due to trimester-specific hemoglobin thresholds and changes in iron metabolism markers. Nevertheless, anemia affects about 37% of pregnant women globally. Pregnancy causes physiological anemia due to hemodilution, as plasma form increases more than red cell mass. Iron needs also rise drastically from 0.8 milligrams per day in non-pregnant women to 8 milligrams per day by the third trimester. Iron deficiency during pregnancy is linked to adverse outcomes such as congenital heart defects, impaired brain development, and long-term neurological and cognitive issues in the baby. Given its serious consequences for both mother and baby, effective prevention and treatment strategies are essential. These are the problem formulations. Here are the purposes of the student project. Here are the benefits.
Hello, my name is Desylia with your last digit of student number 084. I'm going to explain about identifications of examination, especially in anamnesis. Anamnesis for anemia in pregnant women involve gathering detailed information on symptoms, medical history, and dietary habits. Typical symptoms include fatigue, paleness, weakness, and dizziness, which may be indicative of iron deficiency anemia. Medical history is essential in assessing risk factors such as prior anemia, heavy menstrual periods, or gastrointestinal disorder that might impair nutrient absorption. A dietary review helps identify if the patient is consuming enough iron-rich foods such as red meat, leafy greens, and legumes, or if they may have eating habits that inhibit iron absorption, like high intake of tea or coffee. This comprehensive anamnesis allows healthcare providers to determine the likelihood of anemia and guides further testing or treatment plans to address the patient needs and reduce risk to both mother and fetus.
My name is Mahesa with last digit of my student number is 230. And today I will explain about the physical examination need. Physical examination of anemia in pregnant women involves assessing clinical signs and symptoms that indicate reduced hemoglobin level. Anemia during pregnancy is a significant health concern, particularly in developing countries, where it contributes to maternal morbidity and mortality. Physical examination focuses on identifying signs such as clinical pallor and other signs to diagnose anemia effectively. First, clinical pallor. Clinical pallor is key indicator used to detect anemia in pregnant women. It involves examining the coloration of the conjunctiva, nail bed, palms, and buccal mucosa. A study found that clinical pallor, particularly of the palm, has a high sensitivity and negative predictive value for detecting anemia, making it useful diagnostic tool when hemoglobin measurement is not feasible. Anemia is a common condition during pregnancy, with prevalence increasing as pregnancy progresses. In northern Ghana, 50% of pregnant women were found to be anemic, with higher rate in later trimesters. And the second one is hemoglobin and hematocrit level. Anemia in pregnancy is diagnosed when hemoglobin level falls below 11 gram per deciliter, or hematocrit value are less than 33% as per WHO guideline. Hemoglobin level naturally decrease during pregnancy due to increased plasma volume. In study of Japanese women, first trimester hemoglobin level were found to be strong predictor of trimester anemia, with a cutoff of 12.6 gram per deciliter, yielding a sensitivity of 83% for predicting anemia later in pregnancy. These measurements are crucial for confirming anemia and assessing its severity, which can range from mild to severe. That's all from me. Thank you.
Greetings. Hi, my name is Karuniaputri with freelance user number 235. In this topic, we'll be talking about identification of risk factors. So, anemia is actually putting both fetus and mother in risk since pregnancy increasing their nutritional demands, and it is affecting more like 37% of pregnant mother based on WHO data on 2019. For the first risk factors is nutritional and diet. This including a nutritional impair such as an iron, B12, folate, and might be coming together with some poor habits like drinking tea or coffee excessively. Next is infection and chronic disease such as malaria, HIV, UTIs, and chronic kidney disease. If we're talking about the erythropoietin, is a hormone that stimulates red blood cell production. And this condition, both or another risk, is either impair the iron absorption or increasing the breakdown, which leading to anemia. That's it from me. Thank you.
Hello doctors and friends, my name is Christina Natalia with the Trilas student number 109, and now I'm going to present another risk factors for anemia in pregnant women. The first one is age and reproductive history, because younger and adolescent mothers are at a higher risk of anemia during pregnancy. The second one is menstrual and abortion history, which are also the part of reproductive history. Heavy menstrual bleeding or a history of multiple abortion depletes iron stores, heightening vulnerability to anemia. The third one is socioeconomic and lifestyle factors, because limited access to nutrient-rich foods and inadequate prenatal care contributes to anemia risk, especially in low-income settings.
Okay, hello everyone. My name is Ibu Diva Artha with three last digit names number 238. So I'll continue the presentation about the identification of family interaction. So family interaction plays a pivotal role in the prevention and management of anemia among pregnant women. There is a significant correlation between family roles, such as providing informational, emotional, affirmational support, and adherence to anemia prevention strategies. Studies have shown that strong family support significantly correlates with better adherence to iron supplements and nutritional guidelines, which are critical for preventing anemia during pregnancy. For instance, a study conducted among pregnant women revealed that emotional, informational, and affirmational support from family members was associated with improved compliance in taking iron supplements, highlighting the importance of a supportive home environment in promoting health behaviors. Maybe my friend will continue the presentation. Thank you.
Hello, my name is Putu Adisti Sujana, with three last digit of student number is 241. I will be continuing the explanation about identification of family interaction. So family knowledge about anemia and its complication can also influence pregnant women understanding and adherence to treatment regimens. Studies reports that families are actively involved in monitoring and encouraging the consumption of iron tablets. Compliance rate increased substantially. The study also concludes that while knowledge alone may not be significantly impact to compliance, but family support is crucial for encouraging healthy behavior during pregnancy. Furthermore, socioeconomic factors also plays a huge crucial role. Families with lower income or economic status often face higher rates of anemia due to inadequate access to nutritious food and healthcare resources. Therefore, enhancing family engagement through education and support can be a vital strategy to reducing the incidence of anemia in pregnant women, ultimately leading to a better maternal and fetal health outcome. That is all from me. Thank you.
Hello, my name is Indyarwan Ananta Seno with last three digit name 091. 2.4 Identification of disease impact to family. Chronic diseases have had a profound influence on both the person affected and their families. Despite the patient, the repercussion impact manifest facets of family life such as social relation, financial security, and emotional health. Family members experience significant emotional challenges when living with and caring for the loved one with a disease, with the effect often reaching every individual in the household. One of the heaviest burdens on family members is the financial strain, which can arise from treatment costs, transportation to medical appointments, hiring caregivers, and modifying the home. This financial pressure often adds stress and anxiety to the family. The illness also causes and negatively impact family relationship, both between the patient and relative and among other family members, making it challenging to manage the disease effectively. That's all from me. The next part will be explained by my colleague.
Hello, my name is Pradnyana with she's number 178, and I will tell you about the identification of disease impact to the family. So the next one is also social isolation. It is a common consequence of managing chronic illnesses within a family. Pregnant women with anemia may limit social interactions due to physical symptoms such as fatigue, while caregivers might withdraw for social engagement to prioritize the caregiving duties. To alleviate multifaceted burdens of anemia, furthermore, community-based programs that offer nutritional support and financial assistance can significantly reduce the strain of affected family. Thank you.
Importance of family support. Studies indicate that family involvement correlates with improved anemia prevention behavior among pregnant women. Informational, emotional, and practical support from family members significantly aids in adherence to iron and folic acid supplementation. Strategies for improvement. Enhancing family support system and promoting nutritional education are effective strategies. Healthcare providers should focus on fostering a supportive environment and addressing systemic barriers to healthcare access.
Hello, my name is Safrina Putri Donita with 3-digit last student ID number 198. I will to continue the presentation about identification of family medicine approach is providing education to family members, especially partners, about the importance of iron during pregnancy can increase pregnant women's compliance in taking supplement and maintain intake of food rich in iron, which has a positive impact on maternal and fetal health. From a nutritional perspective, families can help provide a food rich in iron such as red meat, nut, and green vegetable, as well as enriching their consumption of vitamin C to help iron absorption. This strategy is important because in general the daily diet might not be enough to meet iron needs during pregnancy. Psychosocial support from the family help reduce stress in pregnant women, which can improve compliance with treatment schedule, especially in dealing with side effects from iron supplements such as digestive disorders. Thank you.
My name is Aryawangsa with my last digit number is 144. Now I will present about summary of our presentation. Anemia in pregnant women is a prevalent condition characterized by low hemoglobin levels, affecting approximately 37% of pregnant women globally. The condition is typically marked by symptoms like fatigue, paleness, and weakness, often resulting from iron deficiency. Risk factors include menstrual bleeding, dietary issues, and gastrointestinal disorders. Diagnosis involves physical examination and laboratory tests, with common causes being iron deficiency, vitamin B12 deficiency, or parasitic infections. Family support plays a crucial role in managing anemia, particularly for women with lower economic status who face challenges in accessing nutritious foods and healthcare. Family medicine can help by promoting nutritional education, ensuring supplement adherence, and creating supportive environment to improve maternal and fetal health outcomes. That's all from our presentation. Thank you for your attention and have a nice day.